Hi, this is Tony Preston. Today I'd like to take you through palpation of the vault. You'll need a reference. You can use your integrative craniosacral manual, which has illustrations here in the overview of anatomy section that has all of the bones in color, as well as larger, more detailed illustrations on the following pages of anterior, lateral, transverse, and inferior views. If you'd like to see this in more detail, or you don't have your integrative craniosacral manual with you, Frank Netter's Color Atlas of Human Anatomy is useful and has the bones in the same color. Let me lay this out here so I can look at it. You'll need to lay that to the side, and you'll need a real person. Get a real person on this, and in fact go through this with a number of different people. Heads vary quite a bit, and you'll learn to palpate these more reliably by understanding those variances. Make sure that you're at a place where you can pause this video and take time to stop on each one of these as I go through them. If we're looking at your book and the person at the same time, this area here is where the frontal bone is located, which is in blue in your book. The parietal bone is here in green in your book. The temporal bone is here in red. The sphenoid is here in yellow, and the occiput is underneath here in purple. This is the occiput. Okay. The frontal bone. If we go through the frontal bone, we would find the articulations here along the nasal bones first. Feel for those on the person that you're working on, and feel for this little suture between the nasal bone and the parietal bone, and feel for where between the nasal bone and the maxilla, and feel for where the maxilla comes into the frontal bone. And then follow the supraorbital ridge over, find where the frontal bone articulates with the zygoma. Work your way around, feel where the frontal bone articulates here with the sphenoid. This is under the temporalis muscle and is harder to palpate. Follow that on around. This little area right here where the sphenoid, parietal, frontal, and temporal bone come together is called pterion, P-T-E-R-I-O-N. From pterion, continue around the coronal suture. Take time to palpate and find how the parietal bone medially here lays under the frontal bone, and how the frontal bone on the lateral aspect lays under the parietal bone. So there are the borders of the frontal bone. Let's talk about the parietal bone next. We've already covered the coronal suture. Just here, the parietal bone connects with the sphenoid. The sphenoid is difficult. This little ridge here is difficult to palpate on most people. The temporalis is pretty thick at this point. But you can, as you feel on back, feel this ridge along the temporal squama where it attaches to the inferior aspect of the parietal bone. If we follow that on around, we find the parieto-mastoid notch. This is an important landmark, and you'll use it quite a bit. So if the person's laying on the table, their ear canal is here. If you go directly behind it, you'll feel a little groove that runs toward the table and toward the ceiling, or anterior to posterior here, and that's where that posterior parietal notch is. If we follow that on around, we'll find the lambdoidal suture, which is the least consistent of the long straight sutures on the top of the vault. It has wormian bones in it like this one here, although on many parietal or many lambdoidal sutures these wormian bones are the size of a quarter. So when you're palpating this, palpate it in detail. Look for differences between the two sides and differences from person to person. If we follow this on around, laying just down on the table almost is lambda. Lambda is this juncture here between the parietal bones and the occipital bone. Find lambda, and just in front of lambda is a little flat space on the sagittal suture, this little flat space here, and that's called obelion. There's a little ridge above that, and then there are these wide interdigitations that follow along through here. And right about here, the interdigitations change to smaller ones. Find this change in interdigitations. It's important. Follow these interdigitations on up, and you come to bregma. Bregma is the juncture between the two parietal bones and the frontal bone here. Okay, so I've covered the parietal bone and the frontal bone, the temporal bone. If I start in the front, the temporal bone, and I'm feeling along underneath the temporalis, there's a ridge here, right where the temporal bone comes up to the sphenoid in the spheno-squamosal border. Feel that ridge, and then feel on around. Feel this juncture here, where the squamous portion of the temporal bone matches with the inferior aspect of the parietal, and back around to the parietal notch. Reach under the mastoid body and feel for the OM suture here on the inferior aspect. You have to go through several layers of tissue here in order to get to that. Feel for that OM suture, find the mastoid body, and then get up onto the mastoid tip. You almost always have to kind of push the ear out of the way in order to get up on the mastoid tip. The sternocleidomastoid is thick and really covers this, and so oftentimes it takes a little bit of extra palpation to go through and find the definition of this mastoid body and mastoid tip. Get far enough up on it to where you can get your thumb kind of on top and maybe a little bit on the inside of that mastoid tip. Once we get to the mastoid tip, if we step in front of the earlobe onto the ear canal here, we have that little tab in the front of the ear. We can feel this process, which is the zygomatic process of the temporal bone, and we can find where it extends along the zygomatic arch and connects with the zygoma here. That simply leaves for us the occiput, and we have already palpated the borders of the occipital bone. What we need to palpate at this point is the EOP, the superior nuchal line, and the inferior nuchal line. So as the person's laying on the table, feel the borders of the occipital bone, the lambdoidal sutures, the occipitomastoid sutures, the OM sutures. Put your hand underneath the bottom, feel the EOP. It's more prominent on some people, less prominent on others. Find the superior nuchal line. If they press their head down into the table, the trapezius will pop out and show you the top medial aspect of that superior nuchal line. And if they turn their head to one way or the other with resistance, the spleni muscles will pop out, and they come right up against that superior nuchal line. And then feel on down and find the inferior nuchal line, which is the ridge just below that. That covers the basic palpation of the cranial vault. Now try this again, as I recommended, on several different people, so that you can find differences in sutures and their depth, and differences in size of processes and shapes of heads and that sort of thing.